Every year, about 23 million pregnancies around the world end in miscarriage. That makes it incredibly common. Yet for many people, it still feels like something you can't talk about. Miscarriage is often surrounded by silence, myths, and misplaced blame. But the truth is, most miscarriages have nothing to do with what someone did or didn't do. They happen because pregnancy itself is such a delicate, complicated process that doesn't always go as planned. So let's take a closer look at what actually happens in the body during those first 12 weeks of pregnancy, when most miscarriages occur, and why, for so many people, it's beyond their control. Think of early pregnancy as a carefully choreographed dance between hormones, the uterus, and the fertilized egg. During the first part of the menstrual cycle, estrogen levels rise. Then progesterone follows, helping the uterine lining thicken and prepare for a possible pregnancy. If no fertilized egg shows up, hormone levels drop, the uterus contracts, and menstruation begins. But when an egg is fertilized, everything changes. That tiny egg begins producing a special hormone called HCG, the same one pregnancy tests detect. HCG signals the ovaries to keep releasing progesterone and estrogen. These hormones stop menstruation and protect the uterine lining, so the embryo isn't rejected as it starts to grow. This is where things often go wrong. Even after fertilization, as many as 1 out of every 3 fertilized eggs never implants properly in the uterus. They're shed during what looks like a normal period, often without the person ever knowing they were briefly pregnant. And even when implantation succeeds, the embryo's DNA takes control of growth. If there are chromosomal errors, something that happens far more often than most people realize, development can stop completely. And this is the leading cause of miscarriage. What it's usually not caused by is just as important to understand. It's not stress, it's not exercise, it's not vaccines, and it's not past birth control use. These are myths. The vast majority of miscarriages are the result of genetic or biological issues. No one can prevent. For some, a miscarriage happens quietly, with little to no noticeable symptoms. In other cases, HCG levels begin to drop, progesterone falls, and bleeding or cramping begins as the body starts to release pregnancy tissue. When that happens, there are 3 main ways a miscarriage can be managed, and all of them are safe and effective. The first option is to wait and let the body pass the tissue naturally. This works for most people, though it can take weeks and involve unpredictable pain and bleeding. The second option uses medication. One pill blocks progesterone, while another pill causes contractions to help the body release the tissue. This process usually works within hours and can often be done safely at home. The third option is a short medical procedure called vacuum aspiration, which gently removes the tissue in just a few minutes, with local anesthesia. Which option someone chooses often depends on their health, their timeline, and their personal preferences. But one thing is clear: without safe access to these treatments, complications like infection or heavy bleeding can become life-threatening. Here's the challenge. The same treatments used for miscarriage care are also used for abortion care. That means in some places, they're restricted, criminalized, or simply unavailable. And when you add the fact that half the world's population still lacks access to even basic reproductive health care, you can see why so many people face unnecessary risks. For many, pregnancy represents hope, change, or the dream of a family. Losing that pregnancy can feel devastating, overwhelming, and lonely. But it's important to remember, miscarriage is not your fault. Everyone deserves access to safe care, clear information, and compassionate support during one of the hardest experiences of their lives. Talking about miscarriage openly is one way we can remove the stigma. and remind people that they are never, ever alone.